treating precancer lesions to help prevent them from becoming cancer. I will also talk about glandular lesions, how we would manage them, and some about management of cancers themselves. The changes between the old guidelines and the new are fairly lengthy. I won't go through all of the lines on this slide. I think it's too much information. But what I would like to do is go through some case scenarios that illustrate the key changes and how we would suggest managing to help prevent progression to cancer. So I'm showing a Pap test, which, as you would expect from what you've seen earlier in the course, is a high-grade lesion. We see cells within this smear that have very large nuclei, they have very scant cytoplasm, and this indicates the presence of a high-grade squamous intraepithelial lesion. So immediately we're worried that this could be a precancer lesion. So our next step will be colposcopy, and if we look at our evidence-based guidelines to say, well, how should we proceed? This is, as guidelines go, a fairly simple one. There aren't a lot of different changes for us to worry about. So one option in an adult patient is when we have a high-grade lesion, we could potentially do an immediate loop excision. This is done in many settings around the world. In the United States, the thinking for that choice is if a patient has poor access to care, perhaps she's not likely to follow up with us, she's not likely to get colposcopic evaluation, then it may make more sense to do the immediate excision as both a diagnostic test that will give us a biopsy in order to make sure we have not missed cancer, but also to do her treatment in a single visit. And so we avoid some of the concerns of poor access to care. On the other hand, if our patient has access to colposcopy, then we would favor colposcopy evaluation, biopsies that are directed, and if the lesions are identified as precancer precursors, then we can have a logical management plan. The advantage of this approach is that in some women, the biopsies may confirm a low-grade lesion, one that does not require loop excision, and so that we may be able to triage our patient to a less invasive treatment, and that would help to protect her future fertility. So if we come back to the colposcopic image that I showed for the Pap test that we have, and we select an area to biopsy within the dense aceto-white lesion, this has sharp, well-circumscribed borders, as we talked about yesterday, and so this would be our concern for the high-grade lesion. This would be the biopsy appearance of that lesion. It shows the proliferation of enlarged nuclei within the squamous epithelium all the way to the surface.